Namaskar, welcome to PK's classes. Today we will discuss the difference between syrup and elixir. If you see, the liquid dosage forms can be two types, monophasic and biphasic. And in the monophasic, we call them as the solutions, which can be used orally, parenterally, and for external purpose. And the elixirs and syrups are coming under monophasic liquid dosage forms, coming under solutions used for oral purpose, orally used. And the biphasic, we know liquid in liquid emulsions and solid in liquid suspensions. So today we'll discuss about the difference between the syrups and elixirs. So first let us see what is syrup. So syrup is a concentrated viscous sweet solution of sucrose in water. Syrup, as per Indian Pharmacopoeia, it is 66.7% weight by weight sucrose in purified water. So 66.7 gram of sucrose in purified water is the simple syrup, IP, Indian Pharmacopoeia. But as per United States Pharmacopoeia, syrup USP, it is 85% weight by volume sucrose in purified water. So 85 gram of sucrose in 1 liter of water, and IP 66.7 gram of sucrose in 1 kg of water, or since water density is 1, so it will be 1 liter of water. So syrup can be simple syrup, medicated syrup, or flavored syrup. Simple syrup is nothing but the saturated sugar solution without flavor or any medicament, which is almost this one, 66.7% weight by weight. So when syrup contains 60 to 85% sugar, it is self-preserving. And when it is medicated syrup, it contains a therapeutic agent, for example, the cough syrup, the paracetamol syrup. Flavored syrup contains only flavoring agent, no medicinal substance, for example, cherry syrup. Now let us discuss about the elixirs. Elixirs are clear, sweetened, hydroalcoholic solutions intended for oral use. The alcoholic content may vary from 5 to 40%, even more also. And because of the alcoholic content, it is self-preserving. Again, elixir can be non-medicated or medicated. When it is non-medicated, it contains no medicament and it is used as solvent or diluting agent only. And when it is medicated elixir, it contains a therapeutic agent or medicinal substance. For example, phenobarbital elixir USP, dexamethasone elixir USP. So they contain the drugs like phenobarbital or dexamethasone. And elixir can also be high alcoholic elixir and low alcoholic elixir. Phenobarbital elixir contains about 75 to 85% alcohol, and low alcoholic elixir contains less amount of alcohol, 10 to 20%. And example is glycyrrhiza elixir, which contains only 8 to 10% of alcohol. So now we'll discuss the difference between syrup and elixir. So the primary solvent used in syrup is water, so it is an aqueous solution. And elixir, the primary solvent are both alcohol and water, so it is a hydroalcoholic solution. So alcohol is the necessary component in elixir, whereas alcohol is not necessary component in syrup. Syrup contains only water. And accordingly, we can say that syrups can have only water soluble components, whereas elixir can have both water and alcohol soluble components. Now, syrup, as we have discussed the definition, it contains high concentration of sugar, which may vary from your 66 to 85% of sugar or sucrose, whereas in elixir it is less proportion of sugar. So naturally syrup is more sweet than elixir, whereas elixir is less sweet than syrup, and because of that also it is syrup is more viscous than elixir, and syrup has thick consistency, whereas elixir has thin consistency. And because of that the elixir is more stable than syrup. Again, because of the sugar content, syrup is more effective in masking the taste of medicinal substances, for example bitter taste drugs. But in masking the taste of medicinal substances, elixir is less effective. From a manufacturing standpoint, syrup is difficult to formulate than elixir, because elixir is preferred over syrups as far as manufacturing is concerned, because elixir is readily prepared. Why? Because of the liquid constituents and small number of excipients. Syrup is not clear, opaque, whereas elixir is a clear formulation. Because of the sugar content, syrup cannot be used for diabetic patients, whereas elixir can be used for diabetic patients. The drugs which can be used in syrups include antibiotics, antitussives, antihistamines, vitamins, analgesics, antipyretics, anticholinergics, etc. The drugs which can be used in elixirs are sedative hypnotics, antihistaminics, analgesics, antipsychotics, steroids, vitamins, etc. So some of the examples of syrup: chlorpheniramine maleate syrup, that is antihistaminic; chloral hydrate syrup, paracetamol syrup, dicyclomine hydrochloric syrup, cholecalciferol syrup, vitamin D syrup. The elixir examples: phenobarbital elixir sedative hypnotic, dexamethasone elixir steroid, fluphenazine elixir antipsychotic, acetaminophen elixir analgesic, antipyretic, then hyoscyamine elixir anticholinergic, bromhexine mucolytic, digoxin elixir digitalis glycoside. So let us see some of the formulations. This is fluphenazine elixir, the antipsychotic, paracetamol syrup, pediatric syrup. This is cholecalciferol syrup, vitamin D. Then this is digoxin elixir. This is a multivitamin elixir, multivitamins. So these are some of the examples. This is a bromhexine elixir. So this is all about the difference between syrup and elixir. Thank you.